Today we are discussing complications of measles. Most of the time, the child recovers completely without any complications, but sometimes they have serious complications, especially if the child is younger than 5 years, if the child is malnourished, or if they are immunocompromised. The complication is higher, and sometimes they even have life-threatening complications. There are certain factors which increases the risk of complications. One, overcrowding. Another, severe malnutrition if the child is immunocompromised. And this is mainly seen in the younger children. Age less than 5 years is another risk factor. The complications will start with system-wise. So in the respiratory system, there might be acute otitis media. This is one of the most common complication that is seen in measles. And there is bronchopneumonia, which is giant cell pneumonia, and pneumonia is the main commonest cause of death in measles. Another is interstitial pneumonia. There might be laryngitis or croup, that is a laryngotracheobronchitis. And then there might be flaring of tuberculosis because child is immunocompromised when they have measles. Other respiratory system complications are bronchiectasis, bronchiolitis, so that is the inflammation of the bronchioles, sinusitis, mastoiditis, and they may have retropharyngeal abscess. Now let's see the CNS infection. CNS infection can be acute, subacute, and chronic. So in the acute CNS infection, number 1 is acute measles encephalitis. This occurs within days, 1 to 6 days after the viral infection. This is caused by direct viral invasion of the brain parenchymal, and this complication is not very common. It is rare, but if it occurs, it has a very high mortality. The second one is ADEM, that is acute disseminated encephalomyelitis, and this occurs within weeks, 1 or 2 weeks after the infection or after the rash. And here there is an autoimmune response. So there is an autoimmune demyelination, and all the CNS complications, they present with altered sensoriums and then seizure, coma. So all these conditions can occur. Another is febrile seizure, 3% cases of febrile seizure that is triggered by the measles virus. Now come to subacute CNS complications. So here measles inclusion body encephalitis can occur, that is also shortly known as MIBE. So this occurs months later, and the cause is due to the persistence of the measles virus viral infection in the brain. And this is most commonly occurring in the immunocompromised patients or individuals, like children having leukemia or HIV, or ones who are getting steroid treatment, so they are immunocompromised. So in these conditions, they may have this condition, and this complication is also almost fatal. Another subacute complications are cerebral thrombophlebitis, which may lead to hemiplegia as a sequelae. Retrobulbar neuritis can occur, Guillain-Barré syndrome can occur. So this is a post-infectious polyneuropathy. And chronic or late CNS complication is SSPE, which the full form of this is subacute sclerosing panencephalitis. And this complication also occurs due to the persistence of the measles virus infection in the brain, and this occurs at around 7 to 12 years after the measles infection, and this can be also life-threatening. Now come to gastrointestinal complications. There can be diarrhea, which may be persistent, and there might be vomiting. Acute appendicitis is another complications which may occur due to lymphoid tissue blocking the lumen of the intestine. And then hepatitis can occur, ileocolitis, malnutrition. So these are other complication of measles. Some other complications can be acute glomerulonephritis in the kidney. Steven-Johnson syndrome can occur. There can be depression of the cell-mediated immunity for few weeks. So this time there can be flaring up of the tuberculosis. And then there can be a bad form of measles, that is hemorrhagic measles, even known as black measles, which leads to hemorrhagic skin eruptions and then may lead to death also. Another complication is in the eyes, which is known as keratitis, and due to the corneal ulceration, the child may become blind. There can be thrombocytopenia. In the heart, there can be myocarditis, and there can be disseminated intravascular coagulation. Let's see what is subacute sclerosing panencephalitis. This complication is important because if it occurs, it is almost fatal. So this is one of the chronic encephalitis which is seen due to the persistence of the viral infection of the brain. But this is rare. But if it occurs, if you can diagnose earlier, the prognosis can be a bit better. Otherwise, prognosis is quite bad. And it occurs 7 to 12 years after the measles infection. It has 3 stages. In the clinical feature, it presents with 3 stages, stage 1, 2 and 3. So in stage 1 is very insidious in onset. Gradually there is changes in the behavior of the child and deterioration of the school function. And the child starts showing very bizarre behavior, and initially you cannot diagnose. And finally there might be dementia, child complains of occasional headache, and then there is actually no fever. So you should take a good proper history. If the child had history of measles around 10 or 12 years ago, then you have to suspect if the child is having this type of symptoms. Then stage 2, the child starts having repetitive jerky movements, that is a myoclonic type of jerk, and there might be cerebellar ataxia and optic atrophy can occur. And in stage 3, the child becomes stuporous, there is coma, there may be rigidity, spasticity, and then or maybe there is flaccidity also. So ultimately the child will die. If they survive with sequelae. Now come to prevention of measles. So isolation of the affected person is the first prevention you do. So by isolating the child, the infection, you can prevent the infection from being spread to the other family members. And another prevention is active immunization, which is the best prevention. So MR, live attenuated vaccine, is given to the child at 9 months of age, and then second dose at 15 months of age. Some countries they give MMR, measles, mumps and rubella, and in some countries MR, that is measles and rubella, is given. And then passive immunization is there, that is given after if the child is exposed to a case of measles. So exposed infants and younger children, they can be given immunoglobulin within 6 days of exposure with the measles case. And susceptible infants, if they are more than 1 year, then vaccination within 72 hours of exposure is recommended. Prognosis, it is a self-limiting disease and then has a good prognosis unless it is complicated. So complication is occurring only if they are having those risk factors. Convalescence may be prolonged sometimes, and 1/3 of the measles they die because of encephalopathy, and then 1/3 they have severe neurological deficit if they survive also. With encephalopathy, if they survive with the neurological deficit. And once you acquire a measles infections, the immunity is lifelong. So you get a lifelong immunity. You will not get measles second time. And SSP prognosis is bad. So most survive 1 to 3 years after the diagnosis. And sometimes occasionally they can live till 10 years. And only less than 10% have remission, and 90% they are fatal or they have mortality. So the death or mortality in measles is due to respiratory and neurological complications. Actually, children, they don't die of measles. Actually, they die because of complications. So respiratory and neurological complication is important. Approximately 90% death is because of complication of respiratory system or neurological system. Respiratory complication is seen more in the younger children, whereas the neurological complications is more seen in the older children. Okay, thank you. So the key points to remember from this class is otitis media is the most common complication that is seen in measles. Pneumonia is the most common cause of death. And SSP is the most dreaded late complications. And as a whole, CNS complication is most bad complication if it occurs. Commonest is pneumonia or otitis media, but if the CNS complication occurs, then if they survive also, they will live with sequelae. So it is bad. So you have to take the intervention in time. So thank you and hope this class was useful to you.